Hi, joining us today on Stop Start Continue is Megan Reed, who's the Program Director of Pharmacy and PCAB at ACHC. Megan, let's talk about your focus. One of your focus areas is on compounding pharmacy. So what's something we should stop doing in that world?
I think as far as I think it's more of the perception of people outside of compounding need to stop
Okay.
unfairly judging compounders.
Hmm.
Especially I would say during the pandemic, with specialty diseases, things that people need to be treated for, that
Hmm.
this is like their last resort. They found their answer in their treatments and compounding.
Okay.
Um, I feel like especially when people are so used to big pharma, they're
Hmm.
not understanding, how traditional compounding affects people every day. We've come a long way, I would say, even since the updated USP chapters being revised and we've talked about before, the whole New England compounding
Hmm.
situation that happened.
Right. Right.
Um, through different things, FDA accreditors such as ACHC and USP, just trying to get everybody safe and on the same page. So I feel like we've come so far. I mean,
Right.
we're 12 years from that situation. And I think just as a community in general, we have worked so hard to maintain standards and
Right.
safety and have rooted out a lot of the bad actors in the space.
Great. Yeah, it feels like, I mean, and and a lot of times this is the most effective way, and maybe sometimes the only source for some of these, medications as we move forward. So,
Hmm.
we'll kind of stop looking down at them. But what's something we should start doing in compounding pharmacy that would kind of help push, patient safety forward?
I think we need to start raising the bar. We've
Okay.
had numerous discussions about how through accreditation, I feel like is a way to show that these pharmacies, especially in PCAB, being PCAB accredited, um, there's only one state, Michigan, that requires that right now, in order
Okay.
for people to get their sterile compounding license. But other than that, it's voluntary, and it's how people have shown compliance. People have shown that they're a step ahead of their competitors in the business. I feel like it really has, it's the gold seal. It's the gold seal as far as, getting that A plus. When you walk into a door and you see that
Mhm.
symbol, then you can rest assured that they've been through the ringer, like, and not in a
Sure.
bad
Yeah.
way, like,
Absolutely.
but that they have gone above and beyond what they really have to do. And so I
Okay.
feel like it shows that these are a set of standards that we follow besides all of the other regulatory bodies that we have to deal with. We've decided to take it a step further by
Right.
becoming accredited. So streamlining our processes, being in compliance with the USP chapters, because
Hmm.
that's a big part of our accreditation standards is they have to comply with USP. So I will say for us, it's an educational and collaborative experience. So I
Right.
think that really does help folks as far as we're not in the, gotcha game. We're not trying to like penalize anybody. We're really trying to help people do the right thing and get everybody on the same page.
Yeah, and I think that that's so important, right? Because it's not about gotcha. It's about how do we move the best practices into as many
Mhm.
pharmacies as possible, as quickly as possible. You
Mhm.
mentioned that with the USP standards going out there, and it's interesting with other pharmacies and other practice areas. Accreditation is just kind of expected, especially in a lot of
Right. It's
kind
part of the payer package, right? Like
right,
for us to get paid or for us to get licensed
right.
in that state to do those different things, especially in the fusion and specialty space. for
Right,
sure.
absolutely, absolutely. So I think y'all are doing a good job of pushing this forward, and hopefully that will just become, the standard, if you will, as we move forward for sure. So we want to kind of stop looking down, at the compounding pharmacies, start raising that bar even further. What's something that we're doing right now that you think is awesome, and we need to continue doing that to increase patient safety and patient outcomes?
I think the best thing that I've seen, and this goes to different organizations that have come together with compounders, is
Hmm.
people in the community just leaning on each other,
Okay.
and kind of raising each other up and sharing. We've seen the different, Mediska, PCCA, Fagron. I would even say, APC is a huge compounding advocacy organization. I think we
Okay.
need to continue to lift each other up and keep holding each other accountable,
Yeah.
whatever it is. Like if you see somebody doing something, if they're your colleague, go talk to them about it.
Mhm.
Or if
Sure.
you have seen success in certain areas, or if these chapters are so open to interpretation, especially with the USP. So
Sure.
we've been hearing a lot of, well, from USP themselves, like, well, we're not a regulatory body. It's up to the accreditation organizations and
Right.
FDA, DEA, whoever. Um, so I think it's really going to be a lot, especially in the next, I would say, 2 years. Especially with boards of pharmacy, there's a lot of them that are implementing the changes
Right.
for like a year and a half to 2 years.
Okay.
So they don't even know what they're doing. So I feel like, and not in a bad way. I think
Right.
the chapter's tough.
Yeah.
795, 797. If you're now doing hazardous, that's
Mhm.
required in a lot of places. So it's just wrapping our arms around all of this information and just kind of just, I feel like if we continue to lift each other up and lift up the industry, I think everybody will take care of each other. It'll take care of itself as far as us like being where we need to be.
Right.
And
Well, and
go ahead.
I was gonna say it is so wide open, and there's just like, here's some guidelines, right?
Yeah.
So, but I feel like the pharmacy world is so small, right, that everybody knows everybody, and let's all figure out what those best
Mhm.
practices are, right, for sure, and implement them.
Yeah,
So
I
great.
think so. Especially, in education, I think there'll be a wide open space for that. So I
Hmm.
feel like as long as we're continuing to show, especially from our surveyors and them going out to different pharmacies, they're gonna try and educate everybody that they can on what they
Right.
know. And
Yep.
so it's like if they can then pass out the information to somebody else. I think that's super helpful.
Right. And there's some great technology out there that can help with that, right?
Oh,
And
for
kind of,
sure.
whether it's within the pharmacy, talking with patients, obviously medical memory's got a great app that can help
Mhm.
with patient education. But I feel like you have to, and even some applicability, I think, within the pharmacy of, hey, here's how we interact, here's how we interpret the 795, 797 regs or standards, so let's move forward together. Well, great. Anything else you'd like to share with the audience today, Megan?
Well, I was just gonna add on to like what you had just said with all the requirements for training and
Hmm.
competencies now. I mean, we're not going to be able to be showing that over and over and over again. So as you said, using video,
Hmm.
such as medical memory, as you said, I think will be very helpful for folks.
Right.
I also think, there's so many um, just different things out there for folks, but I
Right.
feel like we are in a, video digital age
For
now.
sure. Yeah,
So,
absolutely.
especially with the different ways that people learn, I think it'll be helpful.
Yeah, and you all have, ACHCU does such a good job of educating folks too, that
Hmm.
there's so many good resources, and I anticipate that just expanding more and more as we narrow in some of these standards into a best practice. So obviously people need to be checking out ACHCU.
Thank you.
And
Yeah, we have a ton of we'll have more workshops and things coming
great.
out in the coming months, and we also have a compounding manual. We have, different things
Mhm.
coming out. So if people are like, I don't want to write all these SOPs, we have them in our educational arm, which is
Great.
separate from the accreditation.
Fantastic. Well, great. Well, we appreciate you joining us today, Megan. I know your thoughts carry a lot of weight around, and we're really looking forward to what the future for compounding pharmacy brings. So thanks again.
Thank you so much for having me, John.
Of course.